Welcome to Sykes, the Bottom Line Pharmacy Podcast, your regular dose of pharmacy CPA advice to fuel your bottom line, featuring pharmacists, key vendors, and other innovators.
Your checks, yes, you can call me, cause we the best, Sykes Company. We the best, Sykes Company. Your accounting is a mess, there's no need for you to stress. Go online and request from the best. We the best, Sykes Company. We the best, Sykes Company, yes.
Well, welcome everybody to another episode of the Sykes Bottom Line Pharmacy Podcast. We've got Austin in the chair today, taking over Bonnie, the star of the show, who's out with her graduating children, or child, I should say. And then we have Darren Price, independent pharmacy owner of a PBM. How do you pronounce that again?
It's OreadRx.
Past president of the Kansas Pharmacy Association, also involved in the NCPA leadership there as well. So, Darren, we appreciate you being on and taking some time to share some information with our listeners today.
Absolutely. Thanks for having me. I appreciate it.
Yeah. So why don't we just kick it off and kind of give us a background of, your independent pharmacy and specifically how you got into, in the PBM business per se. I'm interested about that. Yeah.
Yeah, absolutely. So, so kind of just going back, we graduated from, so I grew up in Oklahoma, Western Oklahoma, small town out there. Had a mentor that was a pharmacy owner, always wanted to do it. And so, graduated from the University of Oklahoma in 2008. Got an opportunity to buy our first stores in 2010. My wife and I moved to Kansas during that time period, and we are business partners with Osborne Drugs. So Bill and at that time Willie Osborne, they're two great mentors of mine, and we started that partnership in 2010. So I've been a pharmacy owner for 14 years now, which doesn't seem possible because I still view myself as 28 years old, But
I know the feeling.
so we started out. We purchased two pharmacies in 2010. Those were Graves Drug in Winfield and Graves Drug in Arc City. In 2019, we had the opportunity to expand closer into the Wichita, Kansas area. So we bought four more stores in 2019 called the Dam Pharmacies, which is kind of fun. Bought them from a gentleman named Gary Dam. So, you have a lot of fun with that. You go to the Dam Pharmacy to pick up your damn
Did you go to the
drugs.
Dam Pharmacy today? Nope.
That's
I forgot.
right.
Damn it.
So it's a marketing thing,
Oh,
but
yeah.
it's kind of fun. And then last year we bought Mulvane Pharmacy in Mulvane, Kansas, which is also kind of a suburb of Wichita, which brought us to our 7 independent community pharmacies that we have today. So that's kind of my pharmacy hat. And then on the PBM side, me and 3 other independent community pharmacists here in Kansas got together. Actually, they got together before I joined in, and we see all the bad things that happen in the PBM world, and we were very frustrated with the legislative process, like we all are. And we just decided we're just going to do it ourselves. And so we went down the road, formed some partnership with some others that already kind of had PBM, and then just kind of got our feet wet, got on in the space and learned how to do it, and then just have slowly grown to this point. And now we're kind of a completely self-sufficient. And I hate to even call ourselves a PBM because we are truly 100% pass through, 100% transparent, truly the model that I think if others were made to operate like OreadRx, pharmacy and healthcare in general would be in a much different spot today. So that's 30,000 foot view of how I got to where I am today.
So you obviously have a lot of insight into the PBM side, and what you guys are doing there is in terms of transparency and being upfront and clear with everything. So, where do you see the current big PBMs, obviously they have a lot of ways and tricks that they're doing things. What are maybe the top things they could do or Congress could do to help bring about that transparency and change in these PBMs? So what's kind of the low hanging fruit here to get these changes that need to happen?
Yeah. I mean, kind of there's three big things I feel like. Transparency is obviously number one. I mean, every employer group in America that is using one of the big three is getting completely fleeced. I mean, when we go in and do RFPs and are able to do like our live reprice to show people, okay, this is what you paid with your current PBM. This is what you would have paid with OreadRx. It's almost unbelievable, the
Wow.
amount of money that PBMs are stealing from employer groups. And so if that was transparent, maybe they would be able to make some better decisions. Two, rebates. I mean, rebates are what drive everything in the PBM world. And to be honest with you, we don't keep a penny of rebate. Everything that we receive from the aggregator is passed back along to the employer because we view it as their money. And we view ourselves as a true fiduciary of their money. And however, the big three especially don't operate that way. I mean, their formularies are driven by rebate dollars. Their PA processes are driven by rebate dollars. Basically, all of their decisions are driven by rebate dollars. And you see that
Yep.
with Humira, how biosimilars came out that are a fraction of the price of Humira, yet the marketplace, I think the big three are still using Humira 97% of the time, whereas our PBM is using Humira 0.1% of the time, and that was only because of a pediatric case where it wasn't indicated to switch to a biosimilar. So that's where you see that misaligned incentive on that. So transparency, rebate, are kind of the big two that I would say. And then number three, vertical integration is the big one. It's been hard for OreadRx to get into some places because self-funding and being self-insured, it's not a new thing, but just inherently, it's kind of a scary term, and it really shouldn't be. I mean, even traditional insurances operate under, they have reinsurance or stop loss models um, that exist in the self-insurance space. So there's a lot of misinformation around being self-insured and self-funded. But if you're not, it's hard to pick your partners, and so because of vertical integration, you're almost forced to use one of the big
Hmm.
three PBMs at that point. And that's not a good thing because money is shifted from one side to the other and just hidden in ways that you couldn't even really comprehend. And an employer group that just speaks in layman's term on all this deal, on all these things, I mean, you just have no clue about how to even go about evaluating some of this stuff. And so, the mission of our company is to kind of turn that all on its head and show people like the actual savings that are there when you switch from being traditionally insured by one of the big three to, becoming self-insured, being able to pick your partners, everything being transparent, see where your actual healthcare dollars go, and then come up with some solutions to mitigate some of that risk. So it's been a really wild ride for me.
I can imagine.
So the PBM stuff has definitely been, I mean, it's the biggest threat, in my opinion, it's the biggest threat to healthcare, not just to pharmacy. And to be able to influence that in a small way has definitely been the most rewarding experience of my career.
Well, I liked how you said a key word there, fiduciary.
Yep.
That you will not find anywhere in the
No.
big three. I
No,
mean,
I
that
think
is that.
CVS, I think the president of CVS is, or maybe the past president of CVS. Sorry, I'm probably not supposed to say those things, but um, I think he is on record of saying that they are not a fiduciary. They do not act as a fiduciary.
Yeah, that
So,
is crazy. Wow.
yeah.
So, You attended the White House Roundtable.
Hmm.
I got to ask, is that just all show? Is something actually going to come out of that? What's your feeling on that?
Yeah, we were very hopeful that it wasn't all show. Um, anytime I love the awareness. I mean, anytime Mark Cuban is in the room, I feel like that just brings a ton of people to the table, that otherwise would have no idea about PBMs or what they're doing, and so if anything, I was grateful that it brings awareness to people that
Hmm.
maybe otherwise wouldn't have any idea what a PBM is. Um, and there was some really good discussion. There were some really great people in the room. It was kind of one of those things where you sit down, you look around, you're like, I'm in the wrong room here.
How'd I get here?
Why am
Yeah.
I here? But I guess that's yet to be seen. I know the White House has been, they with some of the changes that are coming in the Medicare space, there's still some unanswered questions there, but at least they've been looking, and
Hmm.
I'm hopeful that we've got a window here between now and the end of the year. I'm very hopeful that something can get accomplished. I know NCPA is pushing so hard and doing everything they can with Congress to try to get something passed. So I'm hopeful that it wasn't all for show, but you have to wonder sometimes.
Yeah. When we had Austin, we had Buddy Murray on. I mean, Buddy Carter, not
Mhm.
Austin Murray. Buddy Carter on the podcast a few weeks ago,
Yep.
and I told him that the fact that there's reform PBM signs outside of Capitol Hill is unprecedented. So
Mhm.
I mean, that just goes to show you that the attention's there. It's just got to cross that finish line.
Yeah.
Well, the
I mean,
NCPA is also doing a lot of great work on the consumer side too,
mhm.
in pushing the idea that the PBMs are driving up your drug costs,
Yeah.
and so I think that that's going to help as well because they just recently launched their Finish the Fight campaign, where they surveyed 1,000 customers and all of them, what they across the board they care about their pocketbook, and so that's the theme behind the message. I think that's important. And going back to what you said, Darren, about Mark Cuban, I think it's great having a voice like that can bring a lot of eyeballs and a lot of attention to the issue. So I think that's really important.
Yeah.
And
And it was
Austin,
it was
and
great to meet.
Austin's trying to get Mark Cuban on our podcast. So, Mark, if you're listening, come on board.
Yeah. I'll send it to
Yeah.
him. Um, but it was great to meet Mark. And I think as pharmacists, we're inherently skeptical of anybody that enters the space and is
Mhm.
trying to bring about reform, like what their motives are. But I can tell you in my dealings, because OreadRx does have a partnership with Cost Plus, and so we do business with them. And we know his team, and even his team has told me, Mark wanted to reform the PBM space and didn't really
Yep.
care much about pharmacy or independent pharmacy when he started. However, fast forward to this point, his priorities have shifted from like, I'm going to reform PBM space as 1A. 1B, I want to help independent community pharmacy because he
Hmm.
sees all of the terrible things that are going on in the marketplace, specifically with independent community pharmacy. So I was very impressed by him. And, from everything he said and everything that I've seen, he is truly pushing for reform in the PBM space, and he really wants to help independent community pharmacy.
Yeah. So he obviously sees the value there at the independent pharmacy for sure.
Absolutely, he does.
Yeah. So, Darren, you have your own pharmacy there. Tell us a little bit about maybe Graves Drugs, right? And so, tell us a little bit about the challenges and opportunities you see here in this current environment. We're just getting out of the double DR fee fiasco. I don't want to harp on that anymore. We're past that.
Yeah.
But what do you see as the opportunities ahead for pharmacy?
Yeah. I mean, our biggest challenges obviously are the big three, and we have to. I just did a talk on this last week to a group of grocery chain owners, I asked, what's the biggest challenge facing pharmacy? And, their answer obviously was the big three. I mean, like the contracts that we're getting put in front of us are
Yep.
unsignable right now. Specifically here in Kansas, we're walking away from one of the big three. And I mean, that's 30 to 40% of my business. And so they're the PBM for one of the Medicaid plans here, one of the MCOs. They're, all the national plans, and then, the biggest commercial plan also in Kansas, and we're having to walk away. And so, that's going to cause a huge access issue. And that's, not a good thing for consumers. And so, what do you do at the end of the day? So obviously that's the biggest challenge that we face. And, I think pharmacy can really be a leader in showing people, kind of back to what I was saying about being self-insured. Because after I asked that group, what's the biggest threat, the big three, and I was like, well, how many people get their health insurance through the big three currently? And almost everybody raises their hands in the room. And I was like, why? I mean, Mark Cuban said it best. Like the best way to beat them is to stop doing business with them. You don't have to. I mean, there are other ways to be insured that are not through the big three, and it's really not even that difficult to do. I mean, you get a good broker in there that knows what they're doing to put this together, and it'll save you. I mean, we've seen 70-80% savings whenever you do something like that. And I believe pharmacy can be a leader in showing people, because we are businesses, right? I think pharmacy can be a leader in showing people, let's move away from the old archaic model where we just get money stolen from us and it's not really insurance, to, what would it look like if we used partners that were fiduciaries, and really did have our best interest in mind. And, what does that look like? And every company that we've dealt with that has done that, that's made that shift, has reaped the benefit 100% of the time, reaped the benefits of what that new model looks like. So, I mean, pharmacy can be a leader in doing that, making that transition, and then talking to your employee or your communities, your school districts, your cities, your local businesses. Show them what you did and talk about how it affected you,
Mhm.
and let's make a movement. Let's move away from this outdated archaic system and move into something that's actually healthcare centric.
Yeah. Darren, one of the things you brought up at the roundtable, you brought up a case study of a school district that you worked with,
Yeah,
and just how much like cost savings that you were able to bring them, just by simply transferring them over to a different PBM. And I thought that was
yeah,
that's just very interesting. That yeah.
yeah. That's that school district. In 2019, they were spending $900,000 on drug spend. We took that case over either in 20 or 2021. I can't remember. Fast forward to today, their drug spend, I was just told actually a few weeks ago, is around $400,000 now.
Gosh
So
knows.
almost cut it in half. Um, every year they've been able to give their employees a premium free holiday in December. So Merry Christmas. You don't have to pay for healthcare this month. Um, and then this year, they're actually getting a 16% decrease in premium. And so that's the part that people don't tie together, is because PBMs are so good at using the guise of low copays. We're going to do $0 copays for everybody, but then they have no idea what they're charging the health plan on the backside, right? And so all the employees are happy because they're getting $0 copays, but what they don't see is their premium going up 10, 15, 30% every single year. And
Hmm.
so, on average, and the premium doubles like every 6 to 8 years or something like that. And so they're very, like I said, they're very good at shifting money, but people don't tie together drug spend and premiums, you know. So we've been able to reduce that drug spend, and premiums have followed. Whereas the big three will tell you, if we decrease the drug spend, your premiums are going to go up. So we've been able to show the exact opposite, actually.
Wow. That's powerful stuff right there. I know, Darren, I saw you on webinar with NCPA at one point with kind of having your own insurance company.
Yep.
You and your wife do
Yep.
that. I've got another client that does that as well, a big group, and it's pretty significant what I'm seeing in terms of the numbers. Can you kind of expand on that and kind of how maybe
Sure.
you got started in that? And
Yeah. I mean, I think pharmacies have been helping people choose. The Medicare system is so complicated and it's hard for me to understand it, let alone a 85-year-old widow, like that has nothing to do with healthcare. And so, we've been helping people with that for several years now. And we just said, why not become really the reason that we went down opening our own health insurance agency was because we didn't really feel qualified on the supplement side. So we had a really good idea about how to help people with their Medicare Part D plans, but we were getting so many questions about, other parts of Medicare as well. And so we thought, why not open our own agency and actually get paid by some of the health plans for our time because we're just doing all this for free. That's the way of pharmacy. Let's just do
yep,
things for free.
yep.
Um, so, we decided let's open this, let's do it the right way, let's get all of this knowledge to be able to help people holistically with not just their Part D plan, but all their Medicare. And, there's just so many advantages of doing that. It builds a rapport with your customer base and trust. I mean, they're truly coming to you for all their healthcare needs, insurance, their drugs, and then other things as well. And so it's been a really cool journey. Um, since then, it was just Renee doing it for a long time, but we've got another pharmacist that's now doing it, maybe two more pharmacists that are doing it. And this year, we're going to have two technicians become licensed health insurance agencies to just kind of broaden the amount of people that we're able to help with that.
And you got to balance kind of the conflict of interest there, right? I mean,
Absolutely.
you want to take the best care of the patient possible, but you also want to do what's best for the pharmacy. So you have to bridge that, I'm sure, right?
There's always a win-win
Yeah.
in
Yeah.
those type of scenarios. There's always a win-win that you can find. And yeah, I mean, the frustrating part about that industry is there are so many bad actors out there that are just pointing people to Medicare Advantage plans because of the revenue that they generate from doing so. I think
Mhm.
you can get paid up to $700 for switching somebody to a Medicare Advantage plan, whereas if you just put them in a regular Part D plan, you're making like $70.
Yep.
And so it can be 10 times the amount. And if that's your only revenue source, and I mean, again, PBMs do a really good job of manipulating those people as well to make them think that Medicare Advantage is a great thing. Look at all of these different things that they get because of it. What they don't tell you is, your providers in the area are out of network. Your hospital in the area is out of network. Our hospital in the town where we live doesn't even take Advantage plans anymore. And so that can be really detrimental to their health care. And so we really don't recommend Advantage plans at all, ever. I mean, we do have people that are already there that we have to switch or whatever. Um, and it's different in rural Kansas than like, Chicago or New York City, where
Mhm.
the coverage is just completely different. So I'm not saying that, all Advantage plans are bad, but that's just what we've seen in that industry.
Yep. Mm.
So it's a balance too. So it's just the more you dig into healthcare, the more uh, distrusting you are of just the way things are. I mean, there's just so many things that should be criminal, especially on the PBM side, that just people are just grossly unaware of. And that's the reason why I'm doing what I'm doing. And hopefully, it can make a difference in the end.
I see those PCMA videos they're pushing out now. Why PBMs help this and help that, and you're
Yeah.
just like, come on,
Complete
man.
lies. I mean, it's
Yeah.
all a lie. And I think, that's one of the reasons also that I got into the PBM world is I want to be able to refute those. I mean, we have 100 employers that can say the exact opposite. I was being stolen from for years. And now that I switched to an unbundled self-insured plan, now my claims account has over $1 million in it. I was at a meeting last week. It was with a congressional member actually, and one of the people that was in the room was a physician. And Oread took over the PBM space for his clinic a year ago, and they actually own a pharmacy as well that's in the clinic. And they were saying from the pharmacy standpoint, my revenue doubled. So with this traditional insurance, I was making $6 a claim. Now I'm making between $12 and $14 a claim. Overall, my patients' copays on this plan have decreased. They went from $19 to down to $16. And I have $1 million in my claims fund that I didn't have last year. That would have just gone into the health insurer's pockets, basically.
Amazing.
I mean, that's the power that we've seen when you do something different than what just is traditional insurance. That's the power that it can bring. And he knows exactly where all his healthcare dollars are going, and so that's where we have to get to as a society. We've got to do everything that we can do to educate employers. And I truly believe that pharmacy can be the igniter of that. If we all stop doing business with the big three on our health insurance and lead the way in showing others what can be done, I just believe that could be really powerful.
That would speak volumes for sure. No doubt about it.
You're talking about thousands of businesses across the country.
Just like Mark Cuban says, I mean, he's right. If you keep doing business with them, it's going to keep going. It's just
once you
money
say it out loud,
money talks with the PBMs.
Yeah. I mean, once you say it out loud, if you owned a business, would you do business with the person that's trying to put you out of business?
Right.
Yeah.
I mean, why would you do that?
Yeah.
Doesn't make any sense.
No, it doesn't. Well, Darren, I guess we got to do the bottom line segment, Austin. Bonnie usually kicks that off, but I'll kick it off today. Derek, we do a bottom line segment, kind of summarizing the podcast. I'm going to let you kick it off. Kind of give our listeners here a takeaway, a bottom line, if you will, and finish us off here.
Yeah, and I think I've said it probably 10 times now on this podcast, but let's stop doing business with the big three. I mean, the bottom line is look at your own business and what you're doing for health insurance. Look at doing something different and be talking to employers in the cities, the school districts, the counties, the employers. Be talking to them in your community about how they can do, because they're all complaining about their healthcare costs. Bring them some solutions and show them what is actually going on, and work with a good brokerage, work with a good PBM to be able to shine some light on what's actually happening. And I believe if we can do that collectively as an industry, then we can really start to turn the tide here and win back market share of the PBM space.
And that's a good bottom line. It's a tall order, but hopefully, things continue to evolve and change and move in the right direction. So I'm hopeful. I know a lot of pharmacies are hopeful and see opportunity out there everywhere. So hopefully we see that change happening sooner rather than later. But of course, then we got the election coming up, so Lord only knows. But
yeah.
Well, Darren, thanks again for taking time to be with us today. Appreciate all you're doing in the pharmacy space and leading the charge there. And hopefully we'll get you back on sometime soon, or we'll see you out there on some trade shows.
Yes.